All right, ladies and gentlemen, I welcome you back. And, John Kasich, the governor of the state of Ohio, who's expected to cruise to a re-election, recently, reportedly by the AP, made a remark about how Obamacare is here to stay. And he has since taken that back and clarified. He tweeted out the AP got it wrong. I'm just going to read it to you here. Ohio said no to the Obamacare exchange for a reason. As always, my position is that we need to repeal and replace. Joining us now is Nick Tate, Newsmax Deputy Health Editor and Meet the Doctors contributor. Hey, Nick.
Hey, Steve. How are you?
Good, good, good. So, did he get caught here, Kasich? And if he, did say that in the first place, why would he say that?
Well, the truth is there's been kind of a change in the narrative from conservative Republicans' point of view on Obamacare. From the very beginning, lots of folks have been calling for a complete repeal of Obamacare and replace it with something else, but there's been kind of a shift in that perspective in that some are now saying, well, instead of completely tossing out the law, maybe we can kind of fix it, not nix it, or mend it, not end it. So it's really unclear what the Ohio governor meant when he said that it would not be repealed. Now, the implication was that he was talking about full repeal of Obamacare. He did not see it happening, and the truth is there are some political realities and some practical realities about why Congress would not be able to do that, even if the House took the Senate. But the larger question is whether he was talking about full repeal of Obamacare, or just the component of Obamacare that deals with Medicaid, which he and 8 other Republican governors of 8 other states have now come around and said, well, we kind of like the idea of taking the federal money to expand Medicaid, which is a piece of Obamacare. So it's really unclear what he meant, whether he's caught in the middle, but it does seem to me that he's trying to stake out a kind of centrist position that might put him in a place, should he decide to run for president, to say, well, here's what I really think we should do in terms of health care reform.
Well, yeah, and he did clarify, in addition to the tweet, he clarified his remarks further to the Washington Post, saying, I don't back Obamacare. I never have. I want it to be repealed. And he added that he believed Obamacare would be replaced, quote unquote, flat out, repealed flat out, and replaced if Republicans win control of the House, Senate, and presidency. So at least going forward, as far as the entire shebang, so to speak, he's left no doubt now where he stands.
Well, the truth is that so many aspects of Obamacare have actually already rolled out, and some of them have actually been quite popular. The idea that you can keep your kids on your health insurance till age 26, all the goodies that were tucked into Medicare in the early rollout to kind of sweeten the pot, and also, the ability to cover people who have pre-existing conditions. Those guarantees are pretty popular with folks. So even if there's a change in the law, some of the Republican alternatives to Obamacare that I've seen that have come out, like the so-called CARE program that was unveiled earlier this year, they protect and keep all of those things that people like, but they get rid of some of the more onerous things like the employer mandate that kicks in next year. They would open up exchange, across border, across state exchanges to be able to let you buy health insurance from other states. So, smart money, I think, is on the idea that there will be modifications. The question will be whether there are compromises that both branches of Congress and both Republicans and Democrats can get together on, or whether we're going to continue to have this fractious debate about Obamacare.
Yeah, well, of course, the law was passed without one single Republican vote, and something that I saw a poll recently that a lot more Democrats are saying that the law is hurting them than helping them, and once people are forced onto the Obamacare website and into Obamacare, when the employer mandate does kick in, we're talking tens of millions, and they find out that their family is going to have a $6,000 deductible in many cases. I don't think there's going to be much question about which way the American public is going to want it to go, and that's probably go away. Let me ask you real quick on this Ebola thing. The Homeland Security, we only have a minute, has labeled 5 airports, Atlanta, Dulles, Newark, Kennedy, and Chicago, O'Hare, as the only ports of entry for people from those African countries that are having an Ebola outbreak. Is that a good first step, or we need a total ban?
I think it's a baby step toward travel restrictions. It certainly does not in any way really greatly restrict the influx of people coming from West Africa to the U.S. What it does is it funnels them through these airports that have the 5 security measures in place. But as we saw from the first patient who came here from Liberia who died in Dallas, those security measures can be easily circumvented. You can take
Absolutely.
So, you know, the question is whether
Nick,
they're enough.
Nick, we will speak to you later in the week, and we'll watch you, of course, as part of Meet the Doctors on Saturday mornings right here on Newsmax Television. Thank you, Nick Tate, ladies and gentlemen. There's the book, Obamacare Survival Guide by Nick Tate. Get it, read it, and learn how to survive this mess of Obamacare. Up next, senior fellow at the Center for Security Policy, Fred Flack.